So here are some questions to ask yourself ahead of the ACIP approval of pediatric vaccine this week. Do you consider yourself to be a vaccine ambassador? What will be different about conversations around COVID vaccine for 5 to 11-year-olds compared to vaccine for 12 to 17-year-olds? Also plan now for whether you will vaccinate family members of your 5 to 11-year-old patients and whether you will co-administer flu vaccine with the 5 to 11-year-old COVID vaccine, both of which we highly recommend. Don't send a partially vaccinated child home to an unvaccinated family. So let's talk about being a vaccine ambassador and what that means these days. Did you know that pre-COVID, medical school graduates after 1995 were less likely to trust vaccine efficacy, and especially the vaccine safety infrastructure in the US? Shared decision-making and altered risk perception, which developed in an age of social media, and with younger doctors not seeing many vaccine-preventable diseases in training because the vaccines work so well. Both of these impacted younger providers. So how has COVID changed our minds since then? We've gained a healthy respect for COVID as a disease that needs to be mitigated. But are we ourselves less trustful of our own medical institutions? I think that could be true. However, I don't think that negates our ability to make risk-benefit decisions for our patients and then communicate that decision clearly and simply. That skill is what is needed most now. What we've had to learn more than anything else in this pandemic is to do the best we can for our patients with less data than we're used to. We can move forward and we can learn. Is this ideal state medicine? Of course not. We're practicing medicine during a pandemic with serious underlying flaws in our medical institutions that negatively impact patients of certain race, ethnicities, and communities more than others. We can listen to our patients with this mindset and create a new patient and parent counseling dynamic. We don't have to stick to the dichotomy of shared decision-making versus presumptive recommendation about vaccines anymore. We can evolve. We can be human in our recommendations, acknowledge our own vulnerability, connect with patients in a setting of shared grief and understanding. You have to reflect on your own feelings about this vaccine for your children or other children in your life before having a conversation with parents. These are the basic facts to keep on hand for the conversations. COVID-19 vaccines are safe and effective. That one's easy. COVID-19 vaccines have been used under the most intensive safety monitoring in US history, which includes adolescents. As of 10/13, over 230 million doses of Pfizer vaccine have been given in the US alone, with few serious adverse effects. Most common side effects are temporary redness and pain at the injection site, fever, headaches, and fatigue. The Pfizer safety data for 5 to 11-year-olds is based on about 1,500 kids in the vaccine group and 750 kids in the placebo group. The dose was chosen to balance side effects and how well the vaccine works. So that's reactogenicity versus immunogenicity. You need to tell the parents that their child will need a second shot of the Pfizer-BioNTech COVID-19 vaccine 3 weeks after their first shot, but there is no maximum interval. 12 to 17-year-olds receive the same dosage of Pfizer-BioNTech COVID-19 vaccine as adults. 5 to 11-year-olds will receive 1/3 the dose of adults. COVID-19 vaccine dosage does not vary by patient weight, but by the response of the immune system, which can differ by age. Your child can't get COVID-19 from any COVID-19 vaccine. Make sure you reinforce that, including the Pfizer-BioNTech vaccine. Tell them that their child may get a COVID-19 vaccine and other vaccines at the same visit, or without waiting 14 days between vaccines. So what's a simpler way to explain all this? There have been rare cases of severe illness, hospitalization, and even death from COVID-19 in infants and school-aged children, and there can still be long-term side effects. Children 0 to 11 years old are vulnerable to unvaccinated individuals. Children spread COVID easily in shared living spaces. Let's not miss this opportunity to protect them. Thanks for listening to The Basics, and please watch the next video for quick tips on research around vaccine conversations for parents of 5 to 11-year-olds.